Well, if they can get you to give up one of the most basic things.
There's no limits.
Yes. Exactly.
There's no limits.
Exactly. And then, look, I agree with you that it did start during COVID because it started during this exercise of control and mandating things. Yeah, and they didn't do it based on any data. They didn't do it, especially with young athletes. What they,
so I was like, man, I was back in the gym Monday, hungry to go, and then COVID. COVID. Get title shot. I'm like, I'm about to fight Figgy at 25.
And you got COVID bad, right? Did you get COVID were you in the middle of training when you got it? Like, were you worn out?
Dude, dead. I was doing one training session, and actually I started the whoop. And I was like, man, like my recovery score is 1% in the morning. My HRV was like 13. It was 1% for like a week. And I would only do one workout, and then I'd have to cancel on Chris and Malat. I'm like,
1% is dead.
Dude,
that's crazy.
But then I was like, I'm just going to go ride the bike. I was getting on those bikes doing, 50 to 100-mile rides and just suffering because I had vertigo really bad, so I couldn't get in those uncompromised positions that...
When did you start experiencing vertigo?
Vertigo was my first symptom of COVID, not knowing. And then...
So, the Joe Rogan Experience used to be a place where discussions about DMT, the universe, or the meaning of life were the norm. But once COVID hit, all of that changed very rapidly. Rogan went from being a curious stoner who asked all the questions most of us wanted to ask to becoming an angry little man with a vendetta against traditional media and the democratic establishment. In this video, we'll go over the pandemic to see what really happened to Joe Rogan and what exactly his turning point was in becoming what he is today. So let's go all the way back to the beginning of the pandemic when, just like everyone else, Rogan was quite unsure what to think of this new virus and how dangerous it might be. He decided to bring on experts to inform not only himself but also the people who were watching his podcast. One of the very first guests he invited at the beginning of the pandemic was Michael Osterholm, an expert in infectious disease epidemiology.
What you said when you sat down was absolutely perfect, that the timing could not have been better. Well, tell everybody what you do, Michael.
Well, thank you. I'm, for lack of a better term, a medical detective. I've spent my whole career tracking infectious diseases down, trying to stop them, trying to understand where they come from so we can make sure they don't happen in the first place, but most of all, trying to respond to situations just like this.
Just like this. And just off the bat, how serious is this? Is this something that we need to be terrified of, or is this overblown, or how do you stand on this?
Well, first of all, you have to understand the timing of it in the sense that it's just beginning. And so in terms of what hurt, pain, suffering, death has happened so far is really just beginning. This is going to unfold for months to come yet, and that's, I think, what people don't quite yet understand. What we saw in China, I'm convinced, as are many of my colleagues, as soon as they release all of these social distances, these mandated stay-in-homes, haven't left their home in weeks and weeks kind of thing, when they go back to work, they're on planes, trains, subways, buses, crowded spaces, manufacturing plants. Even China is going to come back again. And so this really is acting like an influenza virus, something that transmits very, very easily through the air. We now have data to show that you're infectious before you even get sick. And in some cases, quite highly infectious. Just breathing is all that you need to do. So from this perspective, I can understand why people would say, well, wait a minute, flu kills a lot more itself every year than this does. And I remind people this is just the beginning. Probably the best guesstimate we have right now on what limited data we have would say this is going to be at least 10 to 15 times worse than the worst seasonal flu year we see.
As the virus began to spread in the US, people became increasingly panicked, and so did Joe Rogan. He decided to bring another expert onto his podcast, someone he had interviewed prior to the pandemic, Dr. Peter Hotez. Now, Dr. Hotez would later become a central figure in our story, but that comes later in this video.
Let's get going. So taking it from the top, let's discuss. Give us your take on how we got here, because this is it's been very strange. Obviously, the president completely miscalculated what was going to happen, and the way he was explaining it to the news, he was kind of saying that it was just a few cases and they'll be gone. And now obviously New York City shut down. The entire country is separated from each other. Everybody is isolating at home. Give us your take on how we got here.
Well, the truth is, we knew this was coming or something like it. We had a heads up, and even a heads up before last year, because this is now our third major coronavirus disaster of the 21st century. We had what's called SARS, severe acute respiratory syndrome, in 2003. That started in China and caused a terrible epidemic in Toronto. It actually took the Rolling Stones to do a concert to bring the economy back to Toronto in 2003. And then it was MERS coronavirus infection in 2012, and this is the third one. So we actually realized that coronaviruses were going to become a new thing, and we embarked on a big coronavirus vaccine program a decade ago. And each time they've caused devastating hospital epidemics. They've affected healthcare workers. So the point is, this unfortunately has become a new normal for the globe, is terrible coronavirus epidemics. And we saw this one coming up at the end of 2019 in China. And I knew we were in for trouble, because that's what coronaviruses do.
Now, as the virus spread throughout the US and the pandemic became increasingly regulated regarding what people had to do to avoid spreading it, Rogan grew more and more opinionated about how the situation was being handled. One of the very first guests to experience Rogan's disagreement with the pandemic regulations was none other than Bill Burr, who didn't hesitate to call out how ridiculous Rogan sounded when he tried to act like he knew what was going on.
And impossible. They did and they didn't. There was people fucking right the whole fucking time. There's been fucking assholes on my street walking around, no masks, not quarantining like the people that come by the houses. You see the fucking, the same people that were going in and out of the house who are not part of their family still going in and out of the house.
You want people to walk down the street with a mask on?
Let's not start this, Joe.
Do you, though?
Let's not start this. Okay.
Let's start it.
I don't want to start this bullshit. I'm not going to sit here with no medical degree, listening to you with no medical degree, with an American flag behind you, smoking a cigar, acting like we know what's up better than the CDC. All I do is I watch the news once every 2 weeks. I'm like, mask or no mask? Still mask? All right, mask. That's all I give a fuck about. I don't care.
But even they say you shouldn't wear a mask unless you're treating a coronavirus patient. The World Health Organization.
Yeah, but they didn't say that initially. They didn't say it initially.
No, they didn't.
They did, and then it gradually, and then wait, and then everybody wore the fucking masks. This is like rollerblading. Everybody fucking rollerbladed, and then there was that one fucking homophobic joke, and then everybody acted like they never did it. And then 100 million fucking rollerblades got thrown into the fucking ocean. We all wore masks, and then all of a sudden, people are fucking sitting there. Well, you don't have the body type for it, dude. Your fucking knuckles would scrape on the ground. Even with that extra 2 inches. I just love how wearing a mask became like this fucking soft thing that you were doing, like being courteous. Bitches. Being courteous. Why is it for bitches? That was so stupid.
You're wearing a mask. First of all,
oh God, you're so tough with your fucking open nose and throat. Gee, Joe, and your 5 o'clock shadow. This is a man right here. A man doesn't wear a mask.
Now, the exact turning point for Joe Rogan's shift into a paranoid Republican convinced the world was against him came on Wednesday, September 1st, 2021, when he posted a video on Instagram announcing that he had tested positive for COVID-19.
Hello, friends. So, I got back from the road Saturday night, feeling very weary. I had a headache, and I just felt run down. And just to be cautious, I separated from my family, slept in a different part of the house, and throughout the night I got fevers and sweats, and I knew what was going on. So I got up in the morning, got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it, all kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, everything. And I also got an NAD drip and a vitamin drip, and I did that 3 days in a row. And so here we are on Wednesday, and I feel great. I really only had one bad day. Sunday sucked, but Monday was better. Tuesday felt better than Monday, and today I feel good. I actually feel pretty fucking good.
So as you've seen, Rogan mentioned several medications, including ivermectin. His announcement sparked significant media attention and public debate, particularly over his use of ivermectin, which the FDA has warned against for COVID-19 treatment. One of the very first media outlets to cover this was CNN, which ran a segment on Rogan's COVID-19 diagnosis and his use of ivermectin.
News this evening, Joe Rogan, an extremely popular podcaster, announced on social media today that he has COVID. Rogan has said young, healthy people don't need to get vaccinated. In his statement on social media, Rogan said he has taken several therapeutics to recover. One of those drugs he mentioned, ivermectin, is something more often used to deworm horses. CDC says there's no evidence it works on COVID. Its increased usage has only led to a substantial increase in overdoses after a push by some on the far right, citing vaccine misinformation.
Now, I genuinely believe this CNN coverage was the tipping point that scrambled Joe Rogan's brain. After that, he was never the same. His podcast shifted from a space of curiosity and thoughtful questions to a platform where he was desperate to prove he was right. The genuine curiosity that kept people coming back for years vanished, replaced by an obsessive need to assert his correctness and a bitter vendetta against the political establishment at the time, which was the Democrats. The shift happened almost immediately. In his podcast episode with Tom Segura, Rogan even mentioned whether or not he should sue CNN for their coverage.
Well. If it isn't old horseworm Rogan. I'm glad you're well, man.
Bro, do I have to sue CNN?
I don't know, do you?
They're making shit up. They keep saying I'm taking horse dewormer. I literally got it from a doctor. It's an American company.
Mm-hmm.
They won the Nobel Prize in 2015 for use in human beings.
Yeah.
And CNN is saying I'm taking horse dewormer.
Yeah, what? So
They must know that that's a lie.
There's a lot of people saying it.
Right, but a lot of people can say it.
Okay.
Like the internet says it, who cares?
sure,
But
it's-
CNN is saying it. Like Jim Acosta.
I meant like USA Today, a few other
Yeah.
places,
and they're
not just
talking
people.
about ivermectin, right?
Yeah.
So what? Because I don't know. I just saw so much news
Yeah.
about you. I mean, I would talk to you and check on you and see if you're all right. And you're like, you threw the kitchen sink at it. You said,
Yeah.
which was stuff that you took IV drips and was it
monoclonal antibodies.
and that what is monoclonal antibodies?
It's the shit they gave Trump.
Okay.
Yeah.
And then what? So who said, or did you already want ivermectin? Like,
Well, I had this guy on, Dr. Pierre Corey, and he is, what is the organization he's from? Frontline COVID Critical Care Workers? Yeah, there's a lot of C's. He's well-established doctors, treated thousands of people with COVID, and they've, early on in the pandemic, they found some good efficacy with ivermectin.
Now, since I'm not a medical expert and I don't want any misinformation to go unchecked, I'll be using Dr. Mike from now on as a reference point to fact-check some of the claims Rogan made. After the situation between the media and Joe Rogan unfolded, Dr. Mike posted a video reviewing all the medications Rogan mentioned, going through what is actually useful and what isn't.
Rogan just announced on social media that he's in fact sick with COVID-19. He does seem to be doing better and we wish him a speedy recovery. He also did announce a wide range of medications that he took to treat COVID-19, which I want to discuss with you today. Here's the clip. One of these on the list, starting with monoclonal antibodies. This is actually a legitimate treatment that's being used widely across the US to prevent severe cases of COVID-19, hospitalizations, and deaths. The way it works is the pharmaceutical companies actually created artificial antibodies that are actually similar to the ones your body makes when it fights off COVID-19. DeSantis in Florida is actually praising this treatment, trying to get more and more people to get it. There is a set of inclusion and exclusion criteria. Basically, it's made for individuals who are at high risk for having severe COVID, but are not yet sick enough to be hospitalized because there is a limited benefit for those patients. Next up, we have ivermectin, which is an anti-parasitic medication used in both humans and animals. Lately, there's been speculation about ivermectin being used to prevent severe cases of COVID-19. However, this hasn't quite played out in the quality research. There have been smaller studies that showed some initial promise, but it hasn't yet held up when we've done serious research. There are some trials still ongoing, but this medication is far from proving a benefit. And this is really important to note because there are individuals across the US who believe in this medication so much that they're actually taking their animals' medication to treat themselves. Folks, do not do this. It is incredibly dangerous. The dosages are not the same. The types of medications are not the same. And we don't yet have proof that it works for COVID-19. There are other medications, there are other therapies that we have available. Do not use ivermectin unless it's for an approved FDA use.
So, obviously, ivermectin is not a good way to treat COVID-19. Now, as the pandemic went on, so did Joe Rogan and his desire to prove that he was right. which basically turned his podcast into a hotspot for misinformation and disinformation. One of the biggest and most important episodes, and another major stepping stone in Rogan becoming what he is today, was his podcast with RFK Jr., which took place just 1 month after the pandemic ended and only 2 months after RFK announced his campaign for the 2024 presidential election. In that episode, RFK made a number of misleading statements, especially about the healthcare profession and vaccines, which led to massive backlash not only from the media but also from Dr. Peter Hotez. Now, as I mentioned earlier, because I don't want you guys to fall for the ridiculous claims RFK makes, I will once again use Dr. Mike, who posted a phenomenal video fact-checking the misinformation RFK tends to spread, which really puts it into perspective how absurd it is that an environmental lawyer could be treated as a serious authority in public health, let alone considered for a role like Secretary of Health and Human Services.
So anyway, all of these new crazy diseases, rotavirus, and were all put on the schedule, and then they started seeing all of this explosion in chronic disease, and particularly autism. So around 1995, CDC, Congress said to EPA, what year did the autism epidemic begin? And EPA is a captured agency, but it's captured by the coal industry and the oil and the pesticide industry, but not by the pharma, because it doesn't regulate pharma. So it actually did a real science, and it said 1989 is the year the epidemic began. It's a red line. And 1989 was the year the vaccine schedule exploded.
The best evidence indicates that Dr. Offit's rotavirus vaccine causes negative net public health impacts. In other words, Dr. Offit's vaccine almost certainly kills and injures more children in the United States than the rotavirus disease killed and injured prior to the vaccine's introduction. Now, I've heard RFK Jr. say that he's really good at reading scientific research.
I'm comfortable reading science and dissecting it and discerning the difference between junk science and real science.
I don't think he does know the difference between junk science and real science, because prior to 2006, before the vaccine was available, rotavirus, which is an intestinal virus that leads to massive diarrhea, vomiting in young children, it hospitalized 50 to 70,000 children in the United States per year. After the implementation of the rotavirus vaccine from Dr. Paul Offit, those rates have fallen by 50,000. And while yes, in a developed country like the United States, the death rate was low, 50 to 60 deaths a year, in developing nations like India, where there isn't good access to medical care for many people, the deaths were much, much higher. So not only are we preventing hundreds of thousands of doctor and ER visits, we're preventing tens of thousands of hospitalizations in the US, and we're saving over 100,000 lives across the globe. This vaccine is what a scientific miracle looks like. The fact that he's not seeing that and seeing it as a net negative, I just don't understand what research we're looking at. Throughout his book, he makes certain references to children having side effects of this vaccine. But when he's looking at the pamphlet that comes with the vaccine, he's just looking at children having conditions. He's not comparing the children in the unvaccinated group to the vaccinated group, because through natural incidents, kids have all sorts of conditions. Kids who were vaccinated have headaches, and kids who are unvaccinated have headaches. The question is, does the rate of headaches go up? And the answer is pretty much no.
Another misleading claim RFK made during his episode with Joe Rogan was that thimerosal, a preservative once used in vaccines, kills brain cells and causes autism. But as Dr. Mike clearly explains, that claim has no scientific basis, making RFK sound absolutely ridiculous.
These huge doses. And he said, well, Bobby, there's two kinds of mercury. There's a good mercury and there's a bad mercury. And the minute he said, and I knew there's a different kind of mercury in the vaccines. It's ethyl mercury in the vaccines and methyl mercury in the fish. But I know by then you can imagine, I know a lot about mercury. I've been suing people. When you sue somebody, you get a PhD in that. You know more than anybody in the world. You have to, or you're not going to win your lawsuit. So I knew a lot about mercury, and I knew that his argument was not with me, but it was with the periodic tables, because there's no such thing as a good mercury. And I also knew the history of why he was saying that, because, mercury was added to vaccines in a form called thimerosal in 1932. And Eli Lilly, which was the manufacturer, was because people knew then that mercury was horrendously neurotoxic. Mercury is 1,000 times more neurotoxic than lead. Well, you would never shoot lead into your baby.
Why was thimerosal introduced into
vaccines? It was
allegedly
introduced as a preservative, but it doesn't kill. Streptococcus or any of the other contaminants you would be worried about. In fact, it kills brain cells at 1/30th the dose that it takes to kill Streptococcus or Staphylococcus. So it wasn't a good preservative. Why?
Probably the most viral claim RFK Jr. has made in his years has been tying mercury, specifically thimerosal, which is a preservative ingredient used in vaccines in the 1990s. He famously wrote an article titled Deadly Immunity that was published in Salon and Rolling Stone magazine, when a study revealed that mercury in childhood vaccines may have caused autism in thousands of kids. The government rushed to conceal the data and to prevent parents from suing drug companies for their role in the epidemic. But the article is so poorly written, it had to be corrected 5 times before finally being retracted. The editor who published it literally states that it was the worst mistake of her life. The ironic part was that on July 1st, 1999, 6 years before the article was written, the FDA already sent a letter to all US vaccine manufacturers requesting them to remove thimerosal as a precautionary measure. Currently, all routine vaccines recommended for children 6 years of age and younger are available in formulations that do not contain thimerosal. And to reiterate, this was a precautionary move, as no research has found any increased health risk from presence of the ingredient in vaccines. And let's run the hypothetical and say that he did uncover some sort of link between autism and thimerosal. Then we should have seen autism rates crumble once thimerosal was removed. But that didn't happen because thimerosal wasn't to blame. And it didn't stop him, by the way, when this article was removed. He went on to write a book about this in 2014.
Now, as I mentioned earlier, one of the central figures in our story is Dr. Peter Hotez, who, after the podcast episode with RFK was posted, he decided to go on Twitter and say the following. Spotify has stopped even sort of trying to stem Joe Rogan's vaccine misinformation. And from all the online attacks I'm receiving after this absurd podcast, it's clear many actually believe this nonsense. Now, this particular tweet led to a heated exchange between Dr. Peter and Joe Rogan, with Rogan responding, "Peter, if you claim what RFK is saying is misinformation, I'm offering you $100,000 to the charity of your choice if you're willing to debate him on my show with no time limit." And Dr. Peter responded with, "Joe, you have my cell, my email, I'm always willing to speak with you." Now, obviously, this Twitter exchange went on for a while, but I think you guys get the gist of it. And until now, we didn't really hear from Dr. Peter about what actually happened between him and Rogan, but just recently, Dr. Mike had him on his podcast, which led to a very interesting conversation about what really went down between Dr. Hotez and Joe Rogan.
Yeah, you have now a rough relationship with Joe Rogan. What happened there? How did it started off positive, right? He was inviting you on as an expert to talk about what's going on in the early days of the pandemic. How did that change? What was the turning point there?
Yeah, well, I'd even went on one of his shows even before the Joe Rogan Experience. I think we did something on whether zombies are real or something like that. And I'd gone on his show a couple of times, and he was great. He was a lot of fun. I even introduced him to my son. He came and he had a comedy act, and he came to Houston, and I introduced him to my son. We hung out, and it was great. And then starting around, and I don't think we've ever exchanged harsh words between each other. It's more like
just publicly.
Not even. I criticize him when he puts out vaccine disinformation and ask him not to do that. But I don't think I'm criticizing. He sometimes goes after me personally, but I try not to go that route. I mean, I don't know him that well. And I certainly have no, harbor ill feelings towards him. But what happened was in 2021, during that Delta wave, you started to see Fox News go into full gear and try to discourage people from getting vaccinated. So in their zeal to push back against vaccine mandates, which you could kind of understand, they started going, unfortunately, that next step and bringing on all these talking heads that would falsely discredit the effectiveness and safety of vaccines. And essentially what Rogan did was, push the agenda, the influencer and wellness industry, which is, built on buying up anything they can that they can get in bulk, like low-cost ivermectin or hydroxychloroquine, jacking up the price, and then selling it with telehealth visits. That's the basis of the health and wellness industry. And so he was pushing hard on the ivermectin. And at that point, I had already been on his show twice, and I was writing to him. I said, Joe, have me on, because what you're doing is dangerous. People are now making decisions based on what they're hearing.
So Dr. Peter makes a great point. No matter how much Rogan tries to downplay his influence and hide behind the same excuse of, I'm just a comedian, don't take advice from me, the truth is he has a massive reach, especially over the people who watch his show. So when he promotes ivermectin as an alternative to vaccines, it's not just misleading, it's dangerously irresponsible.
Not
How
to
did
get
he
vaccinated.
respond to your messages?
There was no response. He just didn't respond at all. And I didn't hear from, that was in 2021, I didn't hear from him in 2 years until he taunted me to debate RFK Jr. along with Elon Musk in the summer of 2023. And
and he put out the $100,000.
The $100,000. And I mean, there were a few reasons why I wasn't going to debate Robert F. Kennedy Jr. First of all,
well, I'm curious before you get into your feelings on that, because I want to discuss that thoroughly. When Joe Rogan offers you $100,000 to debate RFK Jr., ignoring you for 2 years when you were messaging him about misinformation being shared on his show, what do you feel as a human?
Well, it sort of reinforced what the anti-vaxxers are trying to say, that you just bought off the minute for the money, when it's just the opposite, right? I mean, I've devoted my life to, using science for humanitarian purposes. So it was pretty insulting. And then even some of Joe's wealthy friends started adding to the pot, and I didn't even know who would pay the bill, who would actually pay up or not. But I wasn't going to go there.
Got it. Was it true that you were then saying, instead donate to my lab, $50 million?
Yeah, I said that, and then I thought that sounded cheesy too, and I think I took that down,
because I know he highlighted it after the fact.
Yeah. I think I did say that, but then I said, no, that's the wrong message too, because well, first of all, he's not going to do it. He's not going to do it.
Right. So what you were starting to say, what was the concern or reasons that you were against debating RFK Jr.?
Well, there were a few things. One, I'd had a relationship with RFK Jr. because the NIH asked me to speak to him back in 2021, and we can go into more details like that if you like. And I knew it was a waste of time because he was deeply dug in.
Why would they ask that?
What?
Why would they ask you to speak with him in 2021?
The NIH?
Yeah.
No, 2017. I'm sorry.
Oh, 2017.
2017, yeah.
What was that about?
Let's park that for a second, and we'll come back. Let's just finish this train of thought with why I didn't debate RFK. So that was one. I knew it was futile. Second, I felt that they really wanted me out there to sort of schmooze him up, to make him look like an important, because at that time he was running for president, and they wanted to back him for president. And I think they wanted to show him with a serious scientist to help his political campaign, and I didn't want to help him do that. But the third reason was I felt it sent the wrong message to scientists. That's not how we do science, right? We do science through writing our papers in peer-reviewed journals, and we submit grants that don't get discussed or do get discussed and reviewed in scientific meetings. I didn't want to send the message that science is done by a debate with crackpots, that and who was ever says more clever things in a debate. That's how science gets done. I thought that would be very dangerous, sending that message. So all those reasons I didn't. Do
you agree with your decision back then, or do you have any regret?
No, I mean, I could be, given what RFK Jr. has done in public since then, I think it just reinforces that I made a good decision.
So I actually like the fact that Dr. Peter didn't entertain the idea of debating RFK simply because the subject itself has real-life consequences. And speaking of real-life consequences, Dr. Peter's decision to speak out against Joe Rogan and RFK led to some people stalking him outside his house.
During that moment where Rogan offered you the 100,000 and there was some back and forth, you faced a lot of abuse during that time, harassment, anger, vitriol from the general public. What was that like?
Yeah, I mean, and then Elon Musk started weighing in, said something like, what are you hiding, and that kind of thing. I mean, it's, between Elon Musk and RFK Jr. and Joe Rogan, that's just about every follower on Twitter, except those following Taylor Swift, Yeah. So that was a scary place. Mm-hmm. And then I got stalked at my home by an anti-vaxxer, a couple of anti-vaxxers. It was very dark, very, very quickly. And
so in the end, Joe Rogan's journey is a stark example of how a platform built on curiosity can be twisted by ego and influence. What began as a space for thoughtful questions turned into a hotspot for dangerous misinformation, from promoting ivermectin to amplifying the misleading claims of RFK. The transformation shows just how reckless it can be when someone with massive reach prioritizes proving themselves right over actual facts.